Welcome to Get the Facts, the program that provides you with information on government's policies and initiatives. I'm Theodore Henry. Today's discussion will focus on the use of new psychoactive substances among teenagers and the influence, exposure, and accessibility to these and other substances. The May 2022 Rapid Situation Assessment on Substance Use and Urgent Issues in Secondary Schools has shown a shift in the consumption habits of teen users. And we break down the findings with Uki Atkinson, Research Analyst at the National Council on Drug Abuse, NCDA. Welcome to the program, Ms. Atkinson.
Thank you for having me.
All right, let's get the facts. What was it that prompted this study? And if I can go by my notes, 13 parishes, 160 students. What prompted this study?
Okay, so following the return to in-person school, the NCDA received a number of calls from schools across the island. Referrals, requests for interventions, there were increases in confiscation of drug paraphernalia, and then the St. Catherine South Police Division came out with an article basically red flagging the fact that students were engaging in pill parties, that edible use was on the increase in St. Catherine schools, and therefore the NCDA thought it necessary to conduct this rapid assessment. One of the things we want to highlight is the fact that it's not a prevalence survey.
Right.
So when we talk about the shift in consumption levels, we don't necessarily know the current level of consumption. What we did was qualitative in nature. We went to 13 high schools, conducted focus group discussions, as well as interviews among guidance counselors.
Okay. You know, when I saw the shift, I was curious if it's a thing that we're seeing increased consumption, as in compared to numbers prior to COVID.
Right. So it's not about numbers right now because we have not done a survey.
Okay.
Surveys is where you get things like prevalence and, you're able to tell the scope of the problem.
Actual quantity.
Right.
Okay.
No, right. So that's quantitative.
Right.
But this is exploratory in nature to determine what's happening among our students now. What are the substances in their perspectives that are considered to be more popular among them? What are the issues that adolescents are facing now in their perspective, as well as from the guidance counselors?
All right, let's talk about that study and some of the information you got from it, because now I am very curious. So what are some of the key findings? So
a variety of things were disclosed in terms of the issues that adolescents are now facing.
Right.
These ranged, in addition to drug use, there were issues raised about mental health circumstances, the fact that more of our adolescents are exhibiting anxiety and depression and suicidal ideation, the issue to do with physical and verbal aggression, which we are seeing almost weekly in the news.
Amongst peers or?
Among peers, among students in schools. There were guidance counselors who outlined the fact that conflict just out of thin air, escalates. Everybody's on edge kind of thing.
Okay.
The issue of inappropriate social media use, the access to inappropriate content, the issue of poor parenting environment, so the home environment, parental supervision and participation has waned, issues to do with the inability to settle and focus on schoolwork. So there's a wide range. And then, of course, there's the issue of increased substance use, or the perspective that substance use among students has increased.
Did any of the students make any remarks in terms of accessibility?
Absolutely. So, well, first of all, we asked what are the more popular substances. And the three most popular things that came out were Molly, vaping, and edible use. And we explored those further. And for all of those substances, students were able to tell us that they can, get them on the street corner. There were students who were selling it. Right. There were people who had it on their WhatsApp status. They could walk into some facilities to buy vape devices.
So this is known.
And we want to also express the fact that it was across the island. So it's not as though some of these things were confined to a particular type of school or a particular area of the island.
Right.
It is something that across the island they expressed.
I see. I'm also curious, based on the study, you mentioned the stressors and the issues in terms of social conflict. Was there a portion of it that spoke to just purely the recreational aspect of it?
You mean just to take it to have fun? And
Right.
absolutely. And that will always be a reality. All across the world, adolescents experiment with substances because of that pull factor that, is something cool, their peers influence them, and so that is something that is not new. That is something that has been with us and will continue to be with us,
What's the impact of these psychoactive substances on teens?
Okay, so when an adolescent uses a substance, there is a significant risk. First of all, the earlier it is used, is the more likely that problems can develop later on. So our brains are not fully developed until we're in our mid-20s.
Okay.
When substances are introduced to the brain at an early stage.
And sorry, if I can just chip in here. Substances, we've said psychoactive. That
Right. So we're talking about alcohol, which is a depressant. We're talking about cannabis, ganja. We're talking about nicotine. We're talking about MDMA now, which is Molly.
Right.
These things can interrupt the way that the brain develops, especially if a young person goes beyond experimentation and starts habitually using these substances.
Because many of them are addictive.
And absolutely they are. And what our studies have shown is that 1 in 5 adolescents who use a substance, this is Jamaican studies now,
Yes.
1 in 5 is at risk for becoming dependent on it later on. 1 in 5. And so we really want to be able to have people understand that when you introduce your child to a substance at an early age, you really are not helping them, you are potentially harming them.
So the impact is pretty serious.
Yes.
Especially in the teen demographic.
Right. And beyond the brain development issue, it can impact their behavioral patterns, so they can become more aggressive, they can, their academic achievement can be impacted, things like risky behaviors, so they can engage in risky sexual practices. Since we have come out with the results from this rapid assessment, a number of calls have come into the council about people being unknowingly drugged with using Molly.
Unknowingly?
So they're slipping unknowingly. And I'm talking about teenagers, I'm talking about young adults. So this is something that they're sexually assaulted and they only find out the following day. People have told us about videos that people have taken of them that they have no recollection of what they did, pictures taken or people telling them, or even having physical signs that something, occurred with them that they cannot recall.
Wow. All right, we are getting the facts about the impact of the new psychoactive substance on teen users. Don't go anywhere. We continue the conversation with Ms. Atkinson on the other side of this break. Welcome back to Get the Facts. We were discussing the findings of the May 2022 Rapid Situation Assessment on substance use and urgent issues in secondary schools, and we're going to continue that conversation with our guest, Ms. Uki Atkinson, research analyst at the National Council on Drug Abuse. Ms. Atkinson, You have said some very concerning things thus far, but let's keep going. Who is this study being shared with?
So this study is being shared widely. We have shared it with, first of all, our parent ministry, which is the Ministry of Health and Wellness, with the officials from the Ministry of Education, the National Security Council. We have shared it with faith-based organizations, with civil society, with academia. It's broad and wide because this is an emerging situation that all partners need to be on board in terms of the awareness as well as the articulation of strategies to be able to address the situation.
Are the parents getting in on this?
Yes. And there is a public education program which is about to be rolled out nationally. And one of the things that we're grateful about is that this public education is not just a one-shot, one-off, 3 months and then we're out. It's something that's expected to be sustained over time. Which is what is needed for public education.
Definitely. Compound interest builds things.
Exactly.
Yes. What other steps what other intended actions?
So as we said before, this was qualitative in nature. So we want to be able to look and see what is literally happening across the island in terms of the prevalence and practices and patterns of substance use. So there is a national drug prevalence survey about to be rolled out early next year. The last one we did was in 2016, and this is representative at both the parish and national levels. So we will, after that, be able to say what's happening among our population ages 12 to 65 years old. The last one showed that alcohol, tobacco, and cannabis were the main substances being used. But now we can look post-COVID, what is the circumstance? Because we do know that COVID did have an impact on substance use as well.
Oh, definitely. When you mentioned the feelings of anxiety, I just thought COVID.
Absolutely, yes.
There was that there. So what level of support does the NCDA provide? Is it on-the-ground sort of support or policy support?
There is a wide range. So the NCDA, we have a number of programs, prevention programs, drug prevention programs in the communities, in the schools, and at the family level. We also are part of the drug treatment court system, part of the diversion response plan. And we also conduct capacity building, not only in the health sector, but also in the education sector, so that people are better able to determine what are the signs of substance use. How do I screen somebody using a simple tool to be able to determine, okay, do you use? How much do you use? How frequently do you use? And based on the answers, there can be a brief conversation that you have with people to help them have more insight on their pattern of use, as well as refer them, if necessary, to more specialized services.
Does the NCDA provide material, for example?
Absolutely. We do have printed material that we issue in communities, schools, exhibitions, health fairs. We do a lot of that as well.
So a guidance counselor, a principal, even a concerned community-oriented parent can get in touch with the NCDA?
Absolutely. And in fact, in 2020 during COVID-19, or just as it hit, we conducted a number of capacity building sessions among guidance counselors, HFLE teachers, and deans of discipline. 443 were trained in that same screening thing. And we're actually about to do refresher training right now because it is also, it's still always relevant.
Yeah, that's great. As you mentioned, the public education has to keep happening.
Absolutely.
I assume the training has to keep happening because the substances, we're seeing diversity.
Yes, and they're becoming more and more elaborate and more easy for you to mask. So there are students who spoke about vaping in a classroom because the teacher can't smell the vape, the products. It doesn't give off the same smell as traditional cigarettes, right? And so, yes, there is need for us to be more vigilant, for us to be more aware, and then not only that, but to know how to deal with it when it transpires.
I see. Ms. Atkinson, there are parents, there are teachers, there are even many of the students who are watching this program now. I wanted to take a few seconds and just give them your final word. So
we want to say to Jamaica, adults, young, old, The fact that there are new patterns of use of substances in our midst, we want you to be vigilant. Young people, we want to say be careful of the company that you keep, be careful of the things that you are willingly experimenting with, because pleasure for a moment can impact your entire lifetime. And certainly for parents, we want to say be more responsible. You have to be participating in your child's life. You have to be supervising your child for you to be able to protect them from some of these dangers that are out there. Thank you.
Absolutely. Protection is the key word. And for more information, you may contact the National Council on Drug Abuse at 876-926-9002 or ncda.org.jm. That's the website. I'll do that again. It's 876-926-9002 or ncda.org.jm. This has been Get the Facts. Our guest has been research analyst at the National Council on Drug Abuse, Uki Atkinson. Thank you for watching, and until next time, I'm Theodore Henry. Take good care.